After the initial hesitation, the government has included private hospitals in the fight against H1N1 flu. But lately, they are facing flak from the government. So far, there are 670 people who've died in the country. And according to the Health Ministry, most of it is due to late reporting, for which they are holding private doctors responsible.
When Rajesh Paliwal's 13-year-old son recently complained of breathlessness with fever, he was taken to a local private hospital. Doctors there put him on a nebulizer 2 days in a row, not realizing that the child actually had swine flu, confirmed by a test 5 days later. By then, his wife and daughter had also caught the flu.
जिस हॉस्पिटल में मैं गया था, हमारे नियरेस्ट जो भी है, इवन दे आर नॉट एबल टू लाइक एक्सप्लेन कि क्या एग्जैक्टली है. जाके उन्होंने कि भाई एडमिट कर दो, एडमिट नहीं भी करते हो तो ये मेडिसिन ले लो.
The Health Ministry says the Paliwal's case is not isolated. That despite conducting workshops for private doctors in states like Delhi, Gujarat and Maharashtra, where private hospitals are allowed to treat flu patients, many doctors are still unable to cite the symptoms of the flu or treat it quickly.
Typically those cases who are going late and going to the private sector, which still hasn't got its act together on treating H1N1, and it's these delays that are causing the mortalities.
I see many times there is a little confusion amongst doctors that what are the guidelines which are being followed. For example, CDC says now that there is no need to treat the contacts, whereas this is not always being followed in our hospitals.
There are a few lucky ones who survive this time lapse, but as the private sector in our country is included into the system to tackle swine flu, the need of the hour seems to be information and clarity, even within the doctor community. With camera person Umesh in New Delhi, Tanima Biswas for NDTV.
Tuba.com